Hello, my name is Jacqueline Jancount, and my focus for this project will be on the implementation of a bundle in reducing the rates of surgical site infection. The elements of this bundle include CHG cloths, perioperative antibiotic prophylaxis, hair removal before surgery, perioperative normothermia, and discipline in the operating room. Stakeholders include patients, their families, registered nurses, nurses' aides, surgeons, surgical technicians, pharmacists, and anesthesiologists. The role of the patients and their families includes understanding the risk of developing a surgical site infection from a procedure and correctly using the CHG cloths prior to the procedure. Ideally, for an elective procedure, CHG cloths should be used the night before surgery and the morning of the surgery. Patients and their family members must be adequately educated on the use of CHG cloths. The role of the registered nurses includes understanding the elements of the bundle and fully implementing and understanding the use of CHG cloths and perioperative antibiotic prophylaxis. The registered nurse must be able to include and report the use of CHG cloths by the patients and ensure the cloths were used correctly. The nurses' aides are also responsible for giving the CHG cloths to the patients and families to ensure use of the CHG cloths the night before surgery and the day of the surgery. Nurses' aides must be compliant with this part of the bundle. Surgeons are responsible for making sure the patient in surgery receives the correct antibiotic and dose for the perioperative antibiotic prophylaxis. The medication must be administered in a timely manner. According to a study by Carolla in 2012, perioperative prophylaxis was considered correct when a drug was given between 15 and 60 minutes before the incision. Surgeons are also responsible for hair removal prior to surgery if needed. Carolla also concluded that hair removal was preferably not performed, and when it was done, a clipper had to be used. The Journal of Healthcare Contracting states that for many years it has been known that the use of razors prior to surgery increases the incidence of wound infection when compared to clipping or no hair removal at all. The surgeons also are responsible for discipline in the operating room, ensuring compliance with sterile technique and the implementation of the bundle. The circulating nurses are responsible for ensuring bundle compliance, sterile technique, and monitoring the number of door openings from the opening of the sterile equipment until the surgical wound is closed. A study by Carolla in 2012 found that intraoperative noise volume was associated with SSIs, and that this may be due to a lack of concentration or a stressful environment, and may therefore represent a main issue by which to assess the behavior of the surgical team. The role of the anesthesiologist includes ensuring normothermia, which is defined by Carolla as a temperature between 36 and 38 degrees Celsius at the end of the surgical procedure. They are also responsible for bundle compliance and use of perioperative antibiotic prophylaxis. Before the operation starts, a timeout procedure must be in place, which includes the administration of antibiotic prophylaxis. Surgical technicians are responsible for understanding the bundle elements, ensuring sterile technique, and also minimizing door openings during the procedure, mainly making sure all equipment is present before the surgical procedure starts and not entering the operating room for social talks during the surgical procedure. Pharmacists are responsible for making sure that the correct antibiotic medication and dose are prescribed and given at a timely manner. A healthcare professional who had an impact on the development of quality improvement theory and practice was Avidis Donabedian. Donabedian focused on quality issues as they pertain to the healthcare industry on total quality management. Donabedian believed that quality in healthcare is defined by structure, process, and outcome. His quality improvement process accounts for the difficulty of standardizing care-caused variances in populations of patients and among healthcare providers. He believed that different clinical practices could achieve the same outcome and that the role of the quality manager in healthcare is to find the most efficient and legitimate process to arrive at the greatest benefit at the least cost of the patient. This theory therefore applies to implementing a bundle approach to reducing the rates of surgical site infection, since we are implementing a process and standardizing a process of care to improve quality of care that has the greatest benefit while also being cost efficient. Educational needs for each group include understanding the elements of the bundle and compliance with implementation. It is important for everyone to understand the risk of surgical site infections and the prevention methods. BERT 2017 stated that surgical site infections are one of the main complications observed in surgical patients. They are defined as infections whose onset is within 30 days after surgical intervention. The onset of an SSI is linked to an increased risk of patient morbidity, mortality, and to a significant increase in number of days of hospitalization, increased healthcare costs, additional interventions, rehospitalizations, and readmissions. It is important for patients and their families to understand the risk associated with surgical site infection, including what was just stated. Compliance is key to reducing the risk of infection and prevention of surgical site infections. Of course, it is important to consider other factors that are non-modifiable, including other comorbidities that patients may have or an emergency surgery. Everyone must correctly be educated on the use of CHG cloths, when to use them, and how to use them correctly. Surgical staff, nurses, surgeons, aides, and anesthesiologists must understand that bundle implementation and compliance are shown to reduce the rates of surgical site infection. A bundle to reduce the rates of infection would not be effective if there is not 100% bundle compliance. Patients and families will be educated on the value and importance of prevention of a surgical site infection. They will be educated on benefits of CHG cloths, its importance, and the usage. They will also be informed of the bundle and how it is used, educated on their antibiotic prophylaxis medication, and on signs and symptoms of surgical site infection and how it can be prevented. Staff, including nurses, aides, surgeons, anesthesiologists, and surgical technicians, will be educated that a zero-tolerance policy is essential, so that all bundle components are adhered to and with every single patient. In this way, the bundle creates a culture of safety. Bundle compliance will be monitored, and the process will have frequent feedback and discussions that could benefit and help improve the bundle compliance and decrease rates of SSIs. In using a change model to implement this idea, BERT in 2016 stated that the key to developing urgency among colleagues is to help them see firsthand what change needs to occur or why a change needs to occur. Building on that, a guiding team must be formed, encompassing all those who are with a vested interest in improving SSI rates and patient safety. It is also important to form initiatives and coordinated activities that will make a team's vision a reality. This involves the formulation of a clear plan to enable the team to contribute and understand the aim of a practice change and to agree a time period for the achievement of this. There must also be regular contact with staff involved to ensure everyone has adopted the change and to enable data collection. It is also crucial to figure out barriers to change, generate short-term goals, such as decreasing the rates of SSIs for 3 months, and build on change by reviewing things that are ineffective. This also includes sticking to what works, what is successful, implementing it, and staying compliant. The implementation plan for delivering the intervention includes mandatory in-services for all staff involved in the process. They will be educated on elements of the bundle, CHG cloths, perioperative antibiotic prophylaxis, hair removal before surgery, perioperative normothermia, and discipline in the operating room. They will be educated on current rates of surgical site infections, signs and symptoms of infection, and bundle compliance. For CHG cloths, implementation compliance includes giving each patient 2 packs of CHG wipes, one for the night before surgery and the morning of surgery. Instructions on how to effectively use CHG cloths and education for the patients not to apply any lotions, creams, moisturizers, or deodorants after application, and not to rinse. For antibiotic prophylaxis, implementation includes standing orders specifying antibiotic timing, dose, and discontinuation. Development of pharmacist and nurse-driven protocols that include perioperative antibiotic selection and dosing based on surgical type, patient-specific criteria, including age, weight, allergies, renal clearance, and more. And a change of OR drug stocks to include only standard doses and standard drugs, reflecting the national guidelines. The involvement of pharmacy, infection control, and infectious disease staff to ensure appropriate timing, selection, and duration is also important. According to the Journal of Healthcare Contracting, verification of administration time during timeout or pre-procedural briefing is necessary so action can be taken if not administered. For hair removal, Compliance implementation includes maintenance of an adequate supply of clippers and training of staff on proper use. The use of reminders, signs, and posters, education to patients not to self-shave preoperatively, and the removal of all razors from the entire hospital. Discipline in the operating room includes limiting the number of door openings or noises that could lead to distractions, or a break-and-sterile technique. This includes ensuring all materials and supplies are in the operating room and ready for use from the first incision to the closure of the incision. Once patients and family members are consented for surgery, education should be given on CHD wipes, antibiotic use, and, if needed, hair removal. Staff will be educated and informed of bundle compliance, hospital surgical site infection rates to decrease rates, and there will also be annual in-services on bundle implementation and monthly reviews and improvement as needed. I just wanted to thank you for listening to my project on the implementation of a bundle and reducing the rates of surgical site infection. Thank you so much.